Hi, this is Dr. Scott Jensen, and it's Wednesday, August 10th. And let's see, yesterday was primary election day in Minnesota. So I thought, well, let's go ahead and have a conversation the day after the primary elections. And let's talk about something that is near and dear to, I think, the hearts of Minnesotans and Americans, as well as myself. And that would be debates. So we've had, for some candidates, a year and a half of campaigning. Other candidates have perhaps been campaigning for 3 to 6 months. But now the slate is set for the November 8th election. We know who the candidates are. What value do debates have? So let's just start first talking about the value of debate in the arena of healthcare, which I participate in daily, and then we'll talk about it in the arena of responding to a pandemic. But then let's also talk about the value of debate in politics. So we're going to talk about debates having value in healthcare, pandemics, and politics. Okay, so I looked up the word debate, and there was a question that popped up, and it said, what is the value of debate? And this is what it said. Debate teaches individuals the importance of being prepared to listen in 2 ways. Isn't that interesting? Debate, it starts with listening, and they talk about 2 ways. First, it trains people in the mental preparation of listening, having a listening plan. During a debate, what you'd want to do is you want to listen to specific things. So first there's the mental preparation of listening, and then there's the listening for specific things. Things that you want to answer, or you think there's a gap in someone else's logic, or perhaps there's even a gap in your own logic. You want to find support material to help your perspective, or you want to have key points to speak to. So let's talk about healthcare. Today when I came to the office, I had to sign 2 cards, sympathy cards, to families. One was a dear patient of mine, a thick chart. We call it the thick chart sign. I've been taking care of him for a long time. He is in his hundreds, and he passed. And so I had to send a note, or wanted to send a note to the family. And I'm going to call this patient, just for anonymity's sake, I'm going to call him John Doe. But John and I, during our conversations for the last 35 years, did debate. I would make a suggestion that we could do this to help his health. And he would say, no, that wasn't something that he wanted to do. I might say, well, your cholesterol is too high. And he would say, I'm not willing to take a medicine. There was a listening back and forth. He would make his points, I would make my points. Always, he was the leader in terms of the decision making. But there was a debate. Here's another one. This is a friend of mine who passed some time ago. His name is Tom. And Tom is dear to me. He was like my surrogate father because my father died fairly young. But Tom and I would debate also as to what kind of a plan of action would be optimal. I still think of Tom every day. This picture is when he was at our home for Thanksgiving, and we were carving up the turkey, and he was far better at it than I. Perhaps I should have been better at it because I'm, quote, a surgeon in some realm, and yet my wife asked Tom to be the one who carved the turkey that year. But like I say, Tom and I had debate about what we would do, how we would take care of his health care, what would be the ideal approach, what would give him the biggest bang for the buck. Here's another patient I took care of. His name is Chad. And one of the odd debates that Chad and I had was he would not let any doctor tell him what to do unless Chad first had a chance to check it out with me. And he had tremendous confidence in me. And I told Chad that I thought perhaps his confidence was over the top, that there were people he was seeing that were smarter than I am, that he should listen to what they have to say. But Chad would never do anything without coming back and checking with me. But we had ongoing debate. Another patient that passed this morning that I had to sign a sympathy card to the family, we also had debate because she was much more of a naturalist. She did not like the idea of if you will, having medicine intercede, always intruding on her life, whether it be pills or injections, vaccinations, or steroid injections for joint pains. So we had ongoing debate. And I think debate is really healthy in the world of healthcare. So let's flip to pandemics. What was the process, the value of debate in pandemic? Well, obviously, we've had 2.5 years of the COVID pandemic. I would submit that one of the most important things in terms of the debate regarding the pandemic would be right back to the definition I quoted earlier. Debate trains people in the mental preparation of listening. That's what we need to do. We need to prepare ourselves to listen. And someone would say, well, it shouldn't be a debate. Well, let's just take the average citizen who is listening to public health officials. Well, there is a debate back and forth there. The average citizen may be inclined to treat the COVID virus in a way that other viruses were treated, or other severe viruses, a severe influenza virus. Public health might have said, no, public health officials might have said, you need to do this instead. And so there's this debate. And if there isn't a debate, if there's just a declaration, if you will, someone acting like the king or the queen, and if you will, pontificating and declaring to his or her subjects, this is what you will do, then the process of effective action breaks down. And so you don't have that debate, and you have, if you will, people just no longer listening to one another. And that's why when you talk about debate, you have to talk about listening. But then you remember the second part of listening. It has to do with listening for specific points. And I think in the pandemic, we really saw a lack of debate between public health authorities and the everyday American Jane Doe, John Doe kind of citizen. And so without that healthy debate, we ended up seeing people not necessarily complying with public health recommendations. We saw public health recommendations frequently falling down, breaking apart, people saying there was no science behind that recommendation, or sometimes you'd have feuding between the FDA and the CDC. Sometimes you might have feuding between the CDC and the World Health Organization. But again, that debate is so critical. It's so critical so that people can get on the same page. And I found myself in hot water. People were calling me extreme and things like that. I was flabbergasted. I've never really been called extreme in my life, perhaps other than maybe trying to do some athletic things that I'm not that good at, whether it be trying to ski down a mountain full of moguls, or perhaps trying to do something on water skis that I probably shouldn't be doing. Maybe in those situations that was extreme. But in the world of medicine, I've always been quite measured, quite balanced. And I think that for me as a physician, one of the most important things I can share with my patients is the whole realm of context. So when I first started speaking to the issue of COVID, I raised my hand and I said, hold it. The context in terms of how we complete death certificates has always centered around what is the underlying cause of death? What is the initiating event that started a chain of events that led to a patient's demise or death? That's what the CDC had taught me for 35 years, up until 2.5 years ago. But for me, part of the debate at that point in time was context. And yet, in trying to provide context, I found myself being demonized by people. I found the Minnesota Board of Medical Practice being weaponized against me by people who had never received healthcare services from me, but nevertheless wanted to shut me up. And so they used the Board of Medical Practice to, if you will, shut me down or cancel me. But really what I was trying to do was engage in that healthy process of debate where we provide context in terms of how do we complete a death certificate? How do we make the difference between an underlying cause of death and an immediate cause of death, or an underlying cause of death and potentially a contributing factor? This is where the debate needs to take place, and it didn't. The CDC plowed forward pretty hard and fast without the normal conversation times that would take place. I also tried to provide some, if you will, context in terms of method of transmission in regards to the pandemic, and whether or not it's aerosolized or large particle transmission, respiratory, direct contact, fomites. And in those situations, try to, if you will, have a debate, provide context. Then we moved on into the entire arena of lockdowns. Is it scientifically based to have active COVID disease transmitted into a nursing home and then lock everyone in and lock everybody else out once you've, if you will, sort of infected the entire facility? Is there context there that says that that's a good idea? Is there context that says that we should lock kids out of school and tell them that they can do distance learning instead? Is there context to trying to have a 2 and a 3-year-old wear a mask? Is there context for a new mechanism of creating vaccinations? All of this needed to, if you will, stem forward from debate. And that was what I was trying to bring to the table. Now, as we're clearly moving through different phases of the pandemic and hopefully coming to some sort of terminal point in this pandemic, I think we have to ask ourselves the question, do we have the courage to have a debate over the next 3, 6, 12 months? Can Tony Fauci come to the national stage and debate with Dr. Peter McCullough? And can they decide what worked and what didn't? What could we do better next time? Can a Scott Jensen and a Mike Osterholm have a conversation where they talk about, you did this really well, but I really didn't agree with you on this, and vice versa? Can we do these kinds of things? Frankly, the medical profession is going to have to do this. We need to lean on our healthcare leaders, the people that led hospital organizations, led large clinics. We need to have boots on the ground in terms of so many talented people out there that were in the fray, in the constant battle, trying to keep people alive, trying to keep employees working, trying to keep their hospitals going. Can we have the kind of debate we need to have so that we can get ideas on the table so that next time around we'll do it better? You see, we need debate. Debate is the art of listening, the art of focusing on what specific points should we be talking about. Where was the gap in logic? Where was the presumption that wasn't backed by science? This silly notion of claiming follow the science and acting like one person decides what science is or who is the scientist, that's sort of silly. But here we are, as I mentioned at the beginning of this discussion. We're at this point where the primary elections in Minnesota are over, and they're over in a lot of states. And it comes down to the question of debate. I had a debate with my opponent, Governor Tim Walz, a week ago. And since then, I have learned that Governor Tim Walz has said, no, we're not going to debate on Almanac this Friday. We're not going to debate next week with the Minnesota Chamber of Commerce group. We're not going to have a debate at Ramsey, Minnesota, at Game Fair, where we talk about fishing and hunting and tourism. All three of those debates, all three of those opportunities to listen sharper, to prepare to listen, to do our homework, if you will, to have a transparent campaign in front of Minnesotans so people can see what Governor Walz did and why he did it. And they can see why Scott Jensen agreed or disagreed on a given issue. So Tim Walz can come and say, well, Scott Jensen did this or this, and he needs to answer to it. And then I answer to it. If we don't have this debate over the next 90 days, what we're going to have is one more of those routine political campaigns where it's going to be who can spend the most money, who can have the cleverest, most mean-spirited or most effective 30-second ads on TV, who's going to go radio, who's going to do billboards, who's going to do direct mailers. Where does it stop? Don't you think at some point in time it's a little abusive for us to see $50 to $100 million spent on a given campaign? Don't you sometimes wonder how many people could we feed? How many real problems could we solve if we use those dollars in a different way? What's the best way for voters, constituents, to have a chance to understand what the two candidates are saying, where they agree, where they disagree, what the contrast in styles would be, whether we're talking about leading a conversation or leadership in and of itself, where their policies succeeded or failed? If we don't have debate, what we're doing is we're telling Minnesotans, we're telling Americans, what you want doesn't really matter, because the candidates are going to make unilateral decisions based specifically on the game of politics and how much money they have. You see, I think that I've been taking care of patients for 35, 40 years, and we have ongoing debate where I make a recommendation and a patient says, no thanks, doc, I'm not taking that pill. I think there's a tremendous amount of health in that kind of approach to providing care to my patients. And we've had debates during the course of the pandemic. Perhaps we didn't do as well as we could have. And perhaps the best debates, the best contextual debates we're going to have are yet to come as we look at what happened during COVID and what could happen during the next pandemic. But right now, we are in the season of political campaigns, and they're going on across the nation. The world is watching us. The world is wondering, will America debate? Will they step up? What does America stand for? Is it just political slogans? Is it just, if you will, catchy, glitzy political phrases? Is it just about 15 to 30-second TV ads? Or will the leaders in America step up and get on the debate stage and say, listen, debates matter. This is the way we transparently convey to the voters, to the constituents, what matters. I'm exceedingly disappointed right now that Governor Walz literally seems to be taking a path where he's hunkering down, not wanting to talk openly between the two of us about issues, but instead letting his big dollar advantage maybe shape the election. I don't think that's what Minnesotans want. I think they want an honest, open, transparent discussion. And I think, frankly, Minnesotans should be able to ask questions at those debates. So debate is a huge part of the human experience, whether you're talking about within families, communities, neighborhoods, churches, businesses, or whether you're talking about doctor to patient and patient to doctor, or whether you're talking about public health and pandemics, or whether you're talking about campaigns and helping voters decide which candidate do I want to support. So folks, primary elections were yesterday. We basically got a 90-day opportunity to have a transparent discussion. It should be a debate. You should always be listening carefully to specific points. Where does logic fall down? What does extreme mean? What does moderate mean? What does leading mean? And how valuable is context? Does it matter that in America, every day we have 10,000 Americans die? That every year we have 3 million Americans die? That the major leading cause of death is cardiovascular, followed by cancer? Does that change the way we look at how we care for ourselves? So thanks for listening. I wanted to comment. Primary elections are done in Minnesota. It's time for a debate. But it's pretty hard to have a one-sided debate because usually what you end up with then is an empty chair. Think about it. Have a great day. Scott Jensen here. And yes, I am running to be the next governor of Minnesota.